Let's continue our conversation with Congressman Bob Latta, a member of the House Committee on Energy and Commerce. Bob, we just heard from a nurse who ought to be in the know. She says we were not prepared. Has this gone from bad to worse?
Well, again, I think it goes back to what we were saying before the break, that what the guidelines that the CDC have prepared, that their initial statements could be considered inconsistent or contradictory, and so it puts folks out really on the battlefront fighting this disease at a disadvantage of knowing what what's supposed to be done. It's just like when they're told by CDC, well, you can do such and such if you think you might be coming down with the virus, just by checking your temperature, and then, well, if you're at a certain degree, well, you're fine, but if you go over it, we really want to check in. But it's things like that I think that people out here are saying, what are the guidelines? What are the specifications that the medical community is supposed to be dealing with?
Congressman Latta, the Department of Defense has announced they're creating a 30-member support team to deploy for Ebola cases in our country, including 20 critical care nurses, 5 doctors trained in infectious diseases, and 5 trainers in infectious disease protocols. Is this the measure that Congress has been asking for?
Well, the military is always, it's our greatest asset that we have in this country, the men and women that want to protect and service. And again, they have their protocols that they've set forth, and it might be helpful in areas that might not have the expertise at their fingertips to be able to have help from the services. But again, I think it goes right back to that right at the source of the CDC, that they're the ones that are supposed to be establishing those protocols. They're supposed to be set so folks can fight it. So it's that's why as we talked a little earlier, the question as to what's going to happen a little later today when they come out with another set of guidelines. That they're not saying, well, we're going to start all over again, or we're going to have major rewrites, because again, everyone has been doing what they're supposed to be doing out here by following the earlier guidelines.
Bob, we've got a little more than 2 minutes left. There's a report, very disturbing. Judicial Watch reports the administration is secretly working on ways to bring in non-American Ebola patients, bring them into our country for treatment. We're going to hear more on that, but have you heard of that, and what are your thoughts about it?
Well, I really haven't. I just kind of heard just generally of that. That being said, I think that first, putting on your political hat, if I was a Democrat senator in a red state, I think that's the last thing I'd want to hear that what the president's doing. But on the other front, if we're having a problem right now with the CDC, getting the guidelines and having everything set the way it's supposed to be done, how are we supposed to take care of more people coming in? Because again, we had someone come in that the president told us we would never have a situation where we would have an Ebola case, and then we end up with not only that gentleman unfortunately passing away, but then we have the 2 nurses infected. So as you said a little bit earlier, with the nurses saying that, are we prepared? Do we have the guidelines, the protocol set? When you've got some folks in the health community questioning that, and then say you're going to bring more people in, that's a real concern.
We've got less than a minute. Let me ask you, now there is screening at 5 airports in the United States. It didn't happen all at once. It was gradually done. Is this a step in the right direction, or should there be airport screenings for every airport that brings in international flights?
Well, and the problem that we see from the 3 countries that have the Ebola crisis is that you don't get a direct flight from there to the United States. So you're making connection flights. So we have to, in that case, then how do you know where those people have been and where they originated from? So you have to start with, do we have the right visa process going down the entire line to make sure that we know who's coming in?
And that is where, Bob, we will have to end it. Congressman Bob Latta, we thank you for your thoughts. There's more straight ahead on America's Forum.